All right, so are you ready for this?
Yeah, bring it on.
We're diving deep into American health today.
Sounds like a fun one.
Well, maybe not FUN exactly, but important for sure.
Oh, absolutely.
We got a ton of stuff from you guys all about this.
Great.
A whole transcript from this roundtable discussion thing.
Okay.
Hosted by Robert F. Kennedy Jr.
Uh-huh.
With all these doctors and nutritionists and health experts.
Yeah, sounds like a good group.
And honestly, it's a little bit terrifying.
Real.
Yeah, what did you find like the most alarming part of it?
Honestly, the whole thing is a little bleak.
Okay.
They're basically saying chronic diseases are out of control right now.
Yeah, well, I mean, we kind of know that, right?
Yeah, we know it, but they're saying we're missing the real causes.
All right.
Like, we don't actually know why this is happening.
Oh, wow.
And on top of that, get this.
Okay.
They're saying that if you don't count the progress we've made fighting infectious diseases, American life expectancy hasn't really changed in a century.
A century?
Yeah.
That's crazy.
It's a huge red flag.
Yeah, I mean, we all know people dealing with chronic illnesses, right?
Right.
But to think that it hasn't really gotten any better.
Yeah.
Like we're running on this treadmill going nowhere.
Exactly.
So what kind of illnesses are we even talking about here?
Well, they cover pretty much everything.
Okay.
Obesity, type 2 diabetes, Alzheimer's, autoimmune diseases.
Oh, wow.
Mental health issues, even some early onset cancers.
Wow.
And it wasn't just statistics they were throwing around either.
Okay.
They had personal stories too, like Jillian Michaels was talking about her friends struggling with infertility cancer, mental health.
Oh, wow.
These aren't just numbers, these are real people.
Yeah, it's easy to get numb to statistics, I guess.
Right.
But when you hear the stories, it really hits home.
For sure.
So what's at the root of it all?
Well, they pointed to something I think a lot of us probably already suspected.
Okay.
Ultra-processed foods.
Oh, yeah.
Like the stuff that Max Lugavere said makes up 73% of the modern supermarket.
Wow, 73%.
I know, and apparently 60% of the calories that Americans eat come from these ultra-processed foods.
Okay, wait, hold on.
Yeah.
What exactly does ultra-processed even mean?
Yeah, good question.
Is it just anything that comes in a box?
It's a little more insidious than that.
Okay.
These foods are engineered to be hyper-palatable and addictive.
Like, what does that even mean?
So think tons of added sugar, unhealthy fats, artificial flavors, all that stuff.
Oh, okay.
Basically, they're designed to keep you coming back for more.
Even if it's bad for you?
Exactly, even if it's harming your body.
So are they saying these foods are like the new cigarettes?
That's exactly what they're saying.
Addictive and harmful?
Uh-huh. They actually compared them to tobacco.
Wow.
Like, they're both engineered to be addictive.
Hey.
And they cited some research saying that ultra-processed foods are linked to, 32 negative health outcomes.
32.
Yeah, and one of the worst ones is an increased risk of dying early.
So these foods could actually be shortening our lives.
It's definitely a possibility.
That's scary. So how did this even happen?
Right.
Did no one see this coming?
Well, the roundtable talked about the history of the food industry.
Okay.
And honestly, it's fascinating, but also kind of disturbing.
Okay.
So back in the 1950s, the sugar industry went on this huge campaign
Okay.
to promote sugar consumption,
Okay.
but they also demonized saturated fats.
So they were intentionally misleading people
Pretty much.
about sugar.
Yeah. They funded research. They influenced dietary guidelines.
Really?
Uh-huh. They basically shaped how Americans viewed food for decades.
Wow. So how did they get away with that?
I don't know. It's kind of crazy, right?
Yeah.
And then when the dangers of smoking became more clear, the cigarette industry saw an opportunity.
Hold on. What does big tobacco have to do with any of this?
So Callie Means, who co-founded this healthcare company called Tread,
Okay.
he explained that in the 80s, cigarette companies started buying up food companies.
Really?
Yeah.
Wow.
And they brought their knowledge of addiction with them.
Oh, so they knew how to get people hooked.
Exactly. And they basically applied those same strategies to food,
Oh.
leading to these super addictive, ultra-processed foods we have today.
So the same tactics used to get people hooked on cigarettes,
Uh-huh.
now being used to hook us on junk food.
Pretty much.
It's kind of scary how these industries operate.
Yeah, it is.
And you're telling me it gets worse.
It does.
Oh.
So remember the USDA food pyramid?
Oh, yeah.
The one everyone was supposed to follow for healthy eating?
Yeah.
That was influenced by these companies, too. They pushed for choices like refined grains and sugary cereals.
Oh, really?
Yeah, stuff we know now isn't the best for us.
It's like the fox guarding the hen house.
Exactly.
They're everywhere.
And it gets even worse.
Oh, no. Come on.
So they were talking about the corporate influence on our regulatory agencies, too.
Oh, great.
Did you you know that in 2020, 95% of the USDA Dietary Guidelines Advisory Committee had ties to big food and big pharma?
So they're influencing the very people who are supposed to be protecting us.
Pretty much.
No wonder it feels like we're fighting a losing battle.
Right.
What can we even do against that kind of power?
Well, that's where they started talking about regulatory capture.
Okay, what is that?
Basically, it's when the industries being regulated have too much influence over the regulators themselves.
Okay.
And that explains why some really questionable ingredients are allowed in American food.
Like what?
Oh, they had some examples.
Okay.
So Bonnie Patton, this food activist, she was saying that things like McDonald's fries, Skittles, Gatorade, Doritos.
Yeah, okay, I see where you're going with this.
All of them contain ingredients that are either banned or heavily regulated in other countries.
Seriously?
Yeah.
They're selling us stuff that's considered too risky in other places.
It seems that way.
Why are our standards so low?
Well, there are a couple reasons.
Okay.
One is that the FDA has this innocent until proven guilty approach to new chemicals.
What does that mean?
So basically, they're allowed in our food until they're proven harmful.
Oh, so it's like the opposite of how it should be?
Yeah. Europe has a guilty until proven innocent standard.
Oh, that makes a lot more sense.
Yeah, a lot of people in the Roundtable thought so too.
Prove it's safe before you put it in our food.
Right.
Why are we taking these risks?
Yeah. And Jason Karp, who runs this company called Human Co., he brought up another issue.
Okay.
He said that food companies in the U.S. can actually use their own experts to decide if a new chemical is safe or not.
So we're just trusting the companies who stand to profit from these chemicals to tell us if they're safe.
Yeah, pretty much.
So that's reassuring.
It does seem a little problematic.
Yeah, just a little bit.
And when you look at the state of American health, it's hard not to see the connection.
Yeah, this is a lot to process.
Yes.
And we've only just scratched the surface, right?
Yeah, just barely.
They talked about other stuff too, right?
Oh, yeah.
Like stuff that affects our health besides just food.
Yeah, they talked about environmental toxins and stress.
So not just what we're eating, but also what we're breathing, what we're exposed to, how we're feeling. It's all connected.
It really is all connected.
So let's dive into that, Webb.
Okay.
What were some of their concerns about these other factors?
Well, one of the things they talked about was microplastics.
What are those?
They're these tiny little bits of plastic that are showing up everywhere.
Like where?
Like in our food, our water, even our brains.
Microplastics in our brains.
I know, it's kind of freaky.
That's terrifying.
Yeah, and they also talked about pesticide exposure.
Okay.
Especially this one chemical called atrazine.
What's that?
It's used on crops, and it can really mess with your hormones.
Oh, no.
And it's been linked to fertility problems.
So it's not just about what's in our food.
Right.
But how that food is grown.
Yeah. You said
and what it's exposed to.
It's a complex system.
Yeah. This is overwhelming.
I know.
It feels like we're surrounded by all these hidden threats.
I know what you mean.
But they must have offered some solutions, right?
Oh, yeah, they did.
Okay, good.
They actually ended on a pretty hopeful note.
Okay, what did they say?
They talked about consumer choice.
What do you mean?
Like they were saying that by choosing to buy whole, unprocessed foods, we can send a message to the food industry.
Okay.
Like we're demanding something better.
So we can vote with our dollars.
Exactly.
And support companies that align with our values. So even though it feels like we're up against these giant corporations, we actually have some power.
We do. They said that even a small drop in sales, like 5%, can be enough to make these companies rethink things.
Really?
Yeah, they're all about the bottom line. So if we hit them in the wallet, they'll have to listen.
Okay, that makes me feel a little bit better.
Good.
But is that enough?
What?
Like, what about all the other problems?
Right.
The regulatory issues, the environmental toxins?
That's where they talked about collective action.
Okay.
Like, it's not just about individual choices. It's about coming together, sharing information, and demanding better from our leaders.
So we can actually make a difference.
They even called for a bottoms-up revolution.
A bottoms-up revolution?
Yeah, where people prioritize metabolic health and demand a healthier food system.
I love that, a bottoms-up revolution.
I know, it's a catchy name.
Yeah, it is.
It's empowering.
So what are some examples of, like, collective action that has worked?
Well, they actually mentioned a few success stories.
Okay.
Like, remember when Starbucks got rid of caramel coloring from their drinks?
Oh, yeah.
And started publishing ingredient lists?
Yeah.
That was because of public pressure.
Wow.
So it shows that these companies can be influenced.
That's inspiring.
Yeah.
It gives me hope that we can actually change things.
Me too.
And it's not just about the big companies either, right?
Right.
Like they talked about supporting local farmers, community gardens, initiatives that are trying to create a more sustainable and equitable food system.
Exactly.
So it's about making changes in our own lives, but also working to change the system.
It's both individual and collective action.
Wow, this has been a lot.
It has.
A lot of information.
I know.
But it's also really empowering.
It is.
Like, it's clear that the state of American health is a mess.
Yeah.
But there are things we can do to take control
absolutely.
of our own well-being and push for some bigger changes.
Yeah, don't feel powerless.
Okay.
We have more agency than we realize.
I like that.
Just by making informed choices and working together, we can create a healthier future for ourselves and for everyone who comes after us.
Okay, I'm feeling a lot less overwhelmed and a lot more inspired now.
Good.
But this is just the tip of the iceberg, right?
Yeah, we've got a lot more to unpack.
I can't wait to dig deeper.
Let's do it.
Okay, so we've talked about how ultra-processed foods and environmental toxins are like messing with our health.
Right.
But there was another part of this roundtable that really surprised me.
What's that?
They talked about the role of stress and trauma.
Oh, yeah.
I never really made that connection before.
It is pretty fascinating.
Yeah, like our emotions could actually be making us sick.
That's basically what Dr. Chris Palmer was saying.
Who's that?
He's a psychiatrist at Harvard.
Okay.
And he was arguing that trauma can actually change your metabolism.
Really?
Yeah, like make you more likely to get chronic illnesses.
So our emotional well-being is directly tied to our physical health.
That's what he's saying.
Wow.
It makes you realize how connected everything really is.
Yeah, like it's not just what we eat.
Right.
It's also what we're exposed to and how we're feeling.
It's all part of the same picture.
It's kind of overwhelming when you think about it.
It is.
Like, how can we possibly control all of these different factors?
That's where empowerment comes in.
Okay.
The people in the roundtable kept saying that even though we're up against these huge forces, we still have power.
In what way?
Like, we have the power to make choices that support our well-being.
Okay.
We can demand better from the companies we buy from.
Right.
And we can speak up and advocate for change.
So it's not about feeling helpless.
No.
It's about taking action.
Exactly.
Well, where do we even begin?
Well, one simple thing is to start reading food labels.
Oh, yeah. That's always fun.
You know, just pay attention to what's actually in your food.
Okay.
Avoid those ultra-processed foods.
Easier said than done.
I know.
It can be so confusing sometimes.
I know.
Like trying to decipher all those ingredients and stuff.
It's a whole other language.
Yeah.
But there are resources out there that can help.
Oh, yeah?
Like there are apps that can scan barcodes and tell you if something is ultra-processed or not.
Oh, that's cool.
And there are tons of websites and books that explain what to look for on labels and how to make healthier choices.
Okay, so information is key.
Definitely.
But what about those times when you just need something quick and easy? Like, it's hard to resist the processed stuff when you're busy.
I hear you, convenience is a big factor.
Yeah.
But they were saying that healthy eating doesn't have to be super complicated or take forever.
Okay, so what are some simple things we can do?
One tip they gave was to focus on building your meals around whole foods.
Okay.
Like fruits, vegetables, lean proteins, whole grains, that kind of thing.
So real food.
Exactly. They also suggested batch cooking and meal prepping.
Oh, yeah. That's a good idea.
So you can save time during the week.
So you're not scrambling for something quick and easy.
Right. Exactly.
Okay. So it's about being prepared. Having healthy options ready to go.
Yeah. So you're not tempted to reach for the processed stuff.
Makes sense.
And they also talked about not being too restrictive.
Okay.
Like, it's okay to have a treat every now and then.
Right.
You don't have to be perfect.
Balance.
Exactly. It's all about balance.
It's about making sustainable changes that you can stick with.
I like that word, sustainable.
Yeah.
It's not about some crazy diet that you can only do for a week.
Right.
It's about finding something that works for you long term.
And that's where the bottoms-up revolution comes in?
Oh, yeah, I love that.
It's about shifting your whole mindset.
Yeah. And making metabolic health just a part of your life.
Okay, I can get behind that.
Yeah.
But I still feel like there's something missing here.
What's that?
Like, what about all the external factors that influence our choices?
Okay.
Like the marketing and advertising, the fact that healthy food isn't always easy to find or affordable.
You're bringing up some really good points.
It feels like we're being bombarded with messages telling us to eat more and more.
Yeah. And it's usually the unhealthy stuff they're pushing.
It's like they're preying on our weaknesses.
It's true.
Yeah.
They're playing on our biology and psychology.
It's really effective.
It is.
So how do we fight that?
Well, I think awareness is a big part of it.
Okay.
Once you understand how these tactics work, you can start to see them for what they are.
Manipulation.
Yeah, exactly.
So it's about being a conscious consumer. Not falling for all the marketing tricks.
Right, and also supporting policies that restrict unhealthy food marketing.
Like especially to kids.
Especially to kids.
Yeah, they're the most vulnerable.
They are.
Okay, so we need to create an environment where healthy choices are the easy choices.
Exactly. Make healthy the default.
I like that.
Yeah.
But what about those communities where healthy food just isn't available?
Right, like food deserts.
Yeah.
They talked about that too.
Yeah.
Like how lack of access to affordable and nutritious food contributes to all of these health problems.
It's a huge issue.
It is.
So what can we do about that?
Well, they were saying that we need to invest in things like community gardens and farmers markets.
Okay.
Programs that make healthy food more accessible to everyone.
So it's not just about individual responsibility.
No.
It's about creating a system that supports healthy choices.
Exactly.
For everyone.
Right. And that's where advocacy comes in.
Okay.
They're encouraging people to get involved in their communities, to support organizations that are working on these issues,
okay,
and to hold our elected officials accountable.
So they actually do something about it. Okay, so it's a multi-pronged approach.
It is.
We need to make changes in our own lives, but we also need to work together to change the system.
It's both.
Wow, this is a lot.
I know it's a lot to take in.
It is.
But I think one thing that's important to remember is that this isn't just about preventing disease.
Okay.
It's about something much bigger.
What's that?
It's about living a life that's full of vitality and energy and joy.
So it's about thriving.
Exactly, not just surviving.
I love that.
It's about realizing that our health is the most precious thing we have, and we need to invest in it.
This has been a real wake-up call for me.
Really?
Yeah, I need to be more intentional about my choices.
Okay.
And I need to use my voice to advocate for a healthier world.
That's a great goal.
I'm feeling inspired.
Good. I hope this inspires other people too.
Yeah, me too.
Like, this isn't just about following some diet plan or something.
Right.
It's about a much deeper shift in how we think about health and well-being.
It's about recognizing that our health is connected to everything.
Exactly.
Our food, our environment, our relationships, our communities.
It's all connected.
And we have the power to make choices that support our well-being.
On all levels.
It's about taking a step back and asking ourselves, what kind of world do we want to live in?
That's a good question.
And then taking action to make that world a reality.
I like that.
It's a beautiful idea.
It is.
It's about moving beyond the fear and overwhelm.
Yeah.
And embracing the possibility of something better.
A healthier, more vibrant future.
This has been an amazing conversation.
It has.
I've learned so much.
Good.
And I'm feeling hopeful.
That's great.
I'm feeling empowered.
Yes.
And I'm ready to be a part of this bottoms-up revolution.
Me too. Let's do it.
Okay, so we've talked about the problems. We've talked about the solutions. We've talked about collective action.
Yeah.
But what about those of us who are just starting out on this journey? What are some practical tips for navigating this whole world of health and wellness?
That's a good question. I think the best place to start is with yourself.
Okay.
Like, just become more aware of your own habits.
Okay.
Your cravings, your triggers.
So it's about self-reflection.
Yeah.
Taking the time to really understand our own bodies and what we need.
And be kind to yourself.
Okay.
This isn't about perfection. It's about progress.
I like that.
We're all on a journey here.
Yeah.
There are going to be bumps along the way.
So give yourself permission to experiment. To make mistakes to learn.
Exactly. And find what works for you.
Okay.
There's no one-size-fits-all approach to health.
Yeah, that makes sense.
So you have to listen to your body and figure out what feels good.
Okay, so it's about finding what works for you.
Yeah, and being patient.
Patience is key.
It is.
Creating lasting change takes time.
Definitely.
You know, one thing that really struck me about this roundtable discussion was how much they talked about community. Like the importance of connecting with people who share your values and supporting each other on this journey.
That's so important. We're not meant to do this alone.
It's like finding your tribe.
Yeah.
People who understand what you're going through.
Right.
And who can cheer you on along the way.
Exactly. And also sharing information and resources. Like they mentioned all these organizations and people who are doing really great work in this space.
There's a whole movement of people dedicated to creating a healthier world.
There is.
It's really inspiring.
It is.
And there's so many resources out there.
To help us on our journey.
I'm feeling really hopeful.
Me too.
It feels like we can actually create a future where health and well-being are accessible to everyone.
It's definitely possible.
I'm ready to be a part of that.
Me too.
This is a call to action.
It is.
For all of us.
And it starts with each of us taking that first step. Absolutely. Yeah. And remember, every step, no matter how small, makes a difference.
This has been a powerful conversation. It's given me a lot to think about and a lot to act on.
Good.
But most importantly, it's given me hope.
That's what it's all about.
Hope for a healthier future.
Yeah.
Not just for myself, but for everyone.
It's about creating a world where everyone has the opportunity to thrive.
I love that vision.
It's a beautiful vision.
And I believe we can make it a reality.
Me too.
So until next time, stay curious, keep learning, and keep diving deep. So much to think about from all this.
Yeah, no kidding.
I mean, it's kind of overwhelming, right?
I get it. We uncovered some pretty major issues.
Yeah, the food industry, the toxins, the stress.
Like, you can feel like an uphill battle.
It's a lot. Do I have to, become a hermit and grow all my own food now?
Uh-huh. I don't think that's necessary.
But seriously, though, where do we even begin?
Well, remember what we said about balance.
Yeah.
It's not about being perfect. It's about making small changes that you can stick with.
Okay, baby steps.
Exactly.
So what are some things anyone can do, even if they're not ready to, completely change everything?
Yeah. Well, one thing is to just start paying more attention to your food choices.
Oh,
read those food labels. Look for those hidden sugars and all those artificial ingredients.
Yeah, I'm guilty of just grabbing whatever looks good sometimes.
We've all done it, but you'd be surprised how much unhealthy stuff is hiding in plain sight.
Okay, so read the labels.
And prioritize those whole foods. Fruits, vegetables, lean proteins, whole grains.
So it's about making those swaps.
Exactly.
Like an apple instead of a bag of chips.
That's the idea.
And it doesn't have to be all or nothing, right?
Right. It's okay to indulge sometimes.
Good to know.
Just make sure those whole unprocessed foods are the foundation of your diet.
Like building a house, you need a strong foundation.
I like that analogy.
And just like building a house, creating a healthy lifestyle takes time.
Definitely. It's not going to happen overnight.
Be patient.
Exactly.
Celebrate those small victories.
Uh-huh.
Okay, so food choices, what else?
Well, remember we talked about movement, too.
Yeah.
Find ways to get your body moving, even if it's just a short walk or taking the stairs.
I'm definitely guilty of sitting too much.
I think a lot of us are.
Gotta get moving.
And it doesn't have to be some crazy workout routine. Find something you enjoy that fits into your life.
Like dancing or gardening.
Yeah, exactly. Or hiking or swimming.
Anything to get moving.
Exactly.
Okay, so we've got food choices, we've got movement.
Mm-hmm.
What else?
Well, we can't forget about stress.
Oh, yeah. That's a big one.
It's huge.
They were really emphasizing that connection between stress and disease.
Yeah, it's a powerful connection.
And it's so easy to get caught up in the busyness of life and not even realize how stressed we are.
It's true.
So what can we do about it?
Well, they talked about finding healthy coping mechanisms.
Okay.
Like meditation, yoga, spending time in nature journaling.
So finding things that help you unwind.
Exactly.
I like those ideas.
And don't forget about the power of connection.
Okay.
Spending time with loved ones, nurturing your relationships, building a supportive community.
That's a good reminder.
It can make a huge difference.
We're not meant to go through this alone.
We're not.
It takes a village.
Exactly. And if you're really struggling, don't be afraid to reach out for professional help.
Oh, yeah, that's important.
Like if you're dealing with chronic stress or anxiety or depression,
yeah,
there's no shame in talking to a therapist.
We need to normalize that.
We do.
Okay, so remember, knowledge is power.
Absolutely.
The more we understand about our
Yeah.
health and all the things that influence it,
Right.
the better choices we can make.
And don't forget about sharing that knowledge with others.
Oh, yeah.
And advocating for change on a bigger level.
Like that bottoms-up revolution.
Exactly.
We can all be a part of that.
Speak up, support organizations that are fighting for a healthier system. Demand better from our leaders.
It's about recognizing that our health is a collective responsibility.
We're all in this together.
So let's go out there and be the change.
Yes.
Vote with our dollars, make informed choices, work together to create a healthier world.
Let's start that revolution one healthy choice at a time.
This deep dive has been amazing.
It has been.
It's been eye-opening and challenging, but also really empowering.
Definitely.
It's given us so much to think about.
And act on.
But most importantly, it's given us hope.
Hope for a healthier future for everyone.
That's what it's all about, right?
Creating a world where health and well-being are the norm.
A world where everyone has the opportunity to live a vibrant life full of energy and joy.
I love that vision.
Me too. And I think it's a vision we can make happen.
I agree.
So until next time, stay curious, keep learning, and keep diving deep.